clinicians are trained both deeper and broader than most clinicians in the industry, and they have a capability that is built on hundreds of thousands of placements across hundreds of facilities over a long period of time. They are very careful to make sure they make use of best practices, and they are able to safely do a variety of procedures that many facilities don't do internally in-house. It's regardless really of the care environment for the patient.
Yes, I would say proud of our training program where when we have a nurse that comes to us that knows how to do PICCs, that's really the first stage of their learning. The next stage is now we're going to teach them our small bore program for advanced procedures, where you're trained to be able to place lines in the neck or the axillary vein or the femoral. When you're done with that, then you're going to get trained on large bore placement. Maybe they need a temporary dialysis catheter, or they're acutely ill in an ICU and need a large bore central line. Any good nursing education and expansion of skill sets, it starts with didactic training, where you have class time work. And we have the simulation training as well. But that simulation training is never a step off to independence. It's always followed up by careful bedside procedures with an experienced clinician who's sterile at your side. And I believe there's no substitute for that. You know, you can stick as many artificial veins as you want, but until you put that needle into a live person and understand what that patient's going through with their own fears and concerns, and you're able to allay those fears because of your special training, that's a wonderful thing to be a part of. And our training, you know, the pathway to independence on any new procedure goes through the company and the company preceptor. And the preceptor has that same thought in mind. Would I let this person do this procedure on my mother without me here? And when the answer to that is yes, that person's on their own. The ideal procedure is the needle goes into that vein one time and one time only. And that happens with needle visualization. And a big part of our training is needle visualization because it not only gives you confidence in the success of your procedure, you also know that with single wall entry, that you're doing the best for that patient down the road. I believe that a really well-trained vascular access nurse can kind of look at the history and physical, look at the current condition, and maybe what's coming down the road in the case of renal patients, a year, 2, 3, or 5 years from now, and really give that patient the best device at the best time for their condition. We can teach peripheral IV courses. That to have someone teach a course that's also placing the lines all the time is a huge difference. My own personal experience with having a nursing instructor who hadn't placed too many IVs teaching me how to do IVs versus a nurse on the IV team when I was a brand new nurse, it was a world of difference. Whenever you're being taught by a clinical expert, it just makes an immediate difference in the students' reception of the knowledge and also their confidence, because they know that that person, that new nurse knows that an experienced nurse is teaching them and they're speaking from a truth-based perspective. We also provide services like how to identify vascular access devices. Sometimes we have skilled nursing clients, they get a device, they may not be familiar with it. New devices are coming out all the time. We have a class on not only identifying the device, but also the proper care and maintenance of the device. And proper care and maintenance really is a cost saver because you are keeping that device patent. It eliminates a lot of the devices in the facility for a week or two and then stops working because it wasn't being properly maintained. So our care and maintenance class is excellent for people that need those types of services. We also have a class on infection prevention. Everyone knows about hand washing, and hand washing is critical, but there's a lot of other things that go along with infection prevention that are maybe a little outside the box, and we can help, and we have helped clients that have had infection rates they're not happy with reduce those infection rates, which is something we're pretty proud of.